Hi everybody, and thank you so much for inviting me to the Vets for Pets virtual congress. My name is Sue Patterson. I'm a veterinary dermatologist, and what we're going to talk about today is we're going to talk about the part the veterinary nurse can play in enhancing dermatology care within a primary care practice. And to me, this is really, really important indeed. Let's look at our learning objectives for today and just run through those very quickly, because obviously we're going to cover these in an awful lot more detail as we go through our presentation. So first of all, just as a general overview, I want us to talk about the role that the veterinary nurse can play to manage skin disease within a primary care practice. I want to talk about how the nurse can work with the vet, so how nurse can contribute to part of that vet-led team to help improve the quality of patient care. And then moving on from that, the next step is how nurses can actually start to run their own dermatology clinics. So starting off as part of a team and then working independently as individuals within that practice context. And one of the hurdles that we often find when we're talking about nurses and the contribution that they can play is Schedule 3. And a lot of vets don't, I think, appreciate completely what nurses can do under Schedule 3 and what they can't do under Schedule 3. And this is something I put up here deliberately for you. This is available from the Royal College website. This is the superb checklist, and we'll go through each of those letters in just a second in a bit more detail. But it gives fairly detailed guidelines as to what registered veterinary nurses and student veterinary nurses can do. And if you haven't got a copy of this in the practice, or your vets haven't seen this, I think it's going to be a really useful addition to the practice literature that you should have there. Let's look at each of those parts in a little bit more detail. And let's start off with those first three letters, S, U, and P. The first thing we have to say, of course, is that nurses can't do everything. There are acts of veterinary surgery, diagnosis and treatment that under the Veterinary Surgeons Act only vets can do. But within that whole process, within Schedule 3, vets can delegate to nurses lots and lots of things. Things, for example, like minor surgical procedures. They don't actually do diagnosis, but they can actually do the diagnostic tests and report back those test results to the vet. So there's a subtle difference here between actually performing diagnostic tests and making a diagnosis, as far as I'm concerned. Of course, what's really important is anything that the nurse does, anything that's delegated to the nurse by the vet, must be an animal that's under the care of the practice. And of course, the other thing that's really important is the degree of delegation. So it has to be a registered veterinary nurse or a student veterinary nurse that has those tasks delegated to them under Schedule 3. It cannot be a layperson. Something that's really, really important and can sometimes be a little bit of a stumbling block is the experience. And this has to be a two-way thing, that where a vet is asking a nurse to do something, it's really important that that nurse is completely honest with the vet if they don't feel able to do it. They need to be confident and competent to do that. And if they're not, then they need to say to the vet, well, actually, I've only done one of these before. I'd like you to supervise me directly. So be with me while I do it, to talk me through it. Or maybe they say, actually, I've never done one of these before. I need more training. You need to direct me to some resource so I can become more confident to be able to do this. Because the one thing that should not be happening is the vet should be asking nurses to do things that they're not capable and not able to do. The other thing too, which is important, is a risk assessment of each particular delegated task that a nurse is asked to do. And for example, if I was asking a nurse to take a skin biopsy for me, there are some skin biopsies which I would be very confident and comfortable asking a nurse to do, and there would be others which I wouldn't be quite so much so. And that, for example, might be a biopsy taken from a foot pad, or a biopsy taken from a nasal planum, where it's likely to hemorrhage, where the suturing is going to be more important. Those would be things I perhaps might do myself, but I'd be very happy delegating to a nurse many of those other techniques. And then, of course, the other thing that's really important is the degree of supervision that is needed. And the degree of supervision is obviously much greater for a student veterinary nurse than for a registered veterinary nurse. College guidelines actually say that for a registered veterinary nurse, The vet needs to be available, but they do not have to be on the premises. I think I would like to be on the premises for most of these, but again, that's the conversation as a nurse you need to have with your vet, depending on the task, depending on your confidence and your competence. What's really important is you're comfortable with what you're delegated to do. So let's look at that in a little bit more detail. What sort of dermatology work would I be comfortable with registered veterinary nurse doing? Well, diagnostic testing and monitoring under the delegation from a vet, I think is absolutely fine. So routine blood samples for health profiles before an animal perhaps is admitted. Dynamic function tests, so an ACTH stimulation test or a low dose dexamethasone suppression test, a nurse is more than capable of doing. Basic dermatological sample taking, so skin scrapes and plucks, and cytology and biopsy, providing the nurse is trained and confident to do it. The same with ears, sampling from ears, and again with appropriate training, ear flushing, whether that's manual ear flushing or whether that's using equipment such as a video otoscope. There is no reason why nurses can't do that. And then, of course, for me, one of the single biggest strengths of the veterinary nurse is their communication skills. Nurses are absolutely fantastic at chatting to clients at a client's level, so they understand in simple English. So nurses are great at explaining about how to clean ears, about the importance of ectoparasite control and diets, and how to use topical therapy. So things that nurses, I suggest, can do an awful lot better than many, many vets. And of course, the other thing that we have to say as well is that when a nurse does a job and does it as well as a vet, it should be charged in exactly the same way. So should we charge for nurses' time? Of course we should. Nurses are professionals, they're trained, their time is just as valuable as a vet's. And of course, if a nurse is doing something, it perhaps frees the vet up to do other tasks as well. There are practice overheads. I don't have to tell people about this. There's wages, there's the power to the practice. There's actually buying the skin scraping stuff, you know, the scalpel blade, the liquid paraffin, the slides. The cost has to be covered by those as well as the nurse's time. And then, of course, the other thing that is really important is don't offer a service for nothing, because if you do, it's not going to be valued by the client. And the other thing too is it then becomes almost impossible to charge for it at a later stage. So let's look at the ways in which nurses can provide that dermatology support. And as I said before, I'm going to divide this up into two. First is working with the vet to provide support. And then the second is these standalone clinics. Why start off with team working? Well, I think this builds nurses' confidence. It allows them to become confident that, yes, they really can do these things without a vet being present. And then the other thing too, which again I think is really important, is establish that nurse-vet bond, if you will, establishes that trust between the vet and the nurse, because the vet has to be confident that when they delegate a task to a nurse that they're able to do it. And by working with them closely, a vet can actually start to appreciate how fantastic that nurse actually is. And of course, I say it at the bottom, I don't have to say that, I'm talking to the converted here. A nurse is a lot more than just a safe pair of hands. Many years ago when I first qualified, nurses were glorified kennel cleaners. We've moved on from that, I'm pleased to say. Nurses are very competent professionals, and we really do need to use their skills in the best possible way that we can. So let's talk about this first category here, team working directly with the vet. And this is when a nurse comes into their own. This might be a busy Monday lunchtime surgery. It might be a Friday evening surgery and everybody's trying to get away for the weekend off from another crazy busy week. When the waiting room's heaving, you've got animals sitting close to each other, you've got cats getting fractious, you've got patients getting upset, you've got owners becoming impatient because of being kept waiting. And for me, it's far better that a nurse takes them through to a quiet area, to a quiet consulting room if you can, and starts the whole process going, rather than a hassled, busy vet taking them through and taking a rushed history and doing a rushed physical examination. When you're rushed as a vet, you never do the best job that you possibly can. So nurse takes the case through, they take a history off the client. Again, we're not making a diagnosis, we're just collecting facts. They do a general and physical dermatological examination and they record those, and they can then report those back to the vet. So we're saving time, we're providing an enhanced level of client care, we're bonding that client into the practice so they really feel valued given that additional time with the nurse. So let's look at a particular case and see how this nurse-vet interaction could actually work in a skin case. So this is George. George, as you can see, is a young puppy. He's 16 weeks of age. He's a Jack Russell Terrier. The owners have got him from a local rescue centre, and he's presented with really severe generalised skin disease. So the nurse is taking that history as part of this whole process. Taking that history, as a nurse, you discover that the owners had the dog for just a week, but it's had the signs right from the very start. It's had very severe itch, very severe pruritus ever since the owner actually owned it. We know from taking our history that no parasite control has been used by the owner. We know no parasite control was actually used by the rescue centre only. But again, as you get to win your owner's confidence and you start to chat to them, they start to admit to you as well as the dog being itchy and scratchy and sore, they've actually got lesions themselves. They've actually got an itchy rash on their forearms and on their stomach. So little nuggets of information that will make our differential diagnosis list much more specific than it would be without those pieces of information. And again, often I find that owners are much more willing to chat to a nurse than they are to a vet, and sometimes they'll admit to a nurse that they've got that itchy rash. Perhaps they might not actually tell the veterinary surgeon. So the vet checks the dog over, looks through the history, looks through the notes that's taken, and decides, based on what the history has told them, that the nurse needs to admit the dog, and tells the owner that there's going to do some basic diagnostic tests, some scrapes, some plucks, some impression smears, and that we're suspicious with the history and the clinical presentation that this animal may potentially have a parasite problem or may potentially have an infection. So that's the next step. So this is where the nurse now comes into their own. They start to take some hair plucks, and those hair plucks are pretty unremarkable. They don't show anything of any great concern. They take a skin scraping, and when they take a skin scraping, they find what you can see here on the right hand side. This is a Sarcoptes scabiei mite, beautiful round mite, as you can see, those long pedicles and suckers on the end. It's not got those biting mouth parts, those hooked mouth parts that we see with something like Chilatiella. So we found a parasite on the skin scrapings that we're going to report back to the vet. We do some tape strips as well. And when we do some tape strips and we stain those, we find this. And as you can see here, we've got these large pale blue staining squames. And in amongst them, you've got those dark blue or almost purpley shaped little footprints that are absolutely characteristic of Malassezia pachydermatis. So we've got Sarcoptes scabiei on our skin scrapes, and we've got Malassezia pachydermatis. And we can report that information back to our vet. The vet then chats to the owner again, says that based on the tests that have been done, the dog's got sarcoptic mange and the secondary Malassezia infection, and they suggest that we're going to prescribe some therapy. We're going to prescribe what they describe as an oral isoxazoline and a chlorhexidine shampoo, and off the vet goes. But there's a little bit more to it than that, because at this point now it's really important that we have some communication with the client and we talk through with the client what we're doing and why we're doing it, because we know that if a client understands the importance of the treatment, that actually compliance is going to be much better. So as a nurse now, you've got the opportunity to spend some time with that client and talk about the treatment. So the vet's prescribed Simparica. It didn't have to be Simparica. I've just picked that one as an appropriate treatment. The vet's prescribed Simparica. You tell them it's safe in a dog of that age. You tell them that it can be taken with or without food. You tell them we're using an oral preparation because it means we can use a shampoo in combination with it. So little things that emphasize to the owner why it's important to use this and what this drug will actually do. It's a very safe drug that's going to kill that parasite. They've also got some shampoo as well. So it's important again, and again, I've just picked a shampoo out of the air. I've picked some chlorhexidine shampoo. It could have been another chlorhexidine based shampoo. But again, you need to go through with the owner. How do we use this shampoo? We wet the coat, we rub it in, we leave it on. We don't dilute it. We need a contact time of 5 to 10 minutes. We need to rinse it thoroughly. So little things that the nurse can then impart to the client that means the treatment protocol is going to be that much better. The owner is going to be much more compliant. And we're far more likely to get a good clinical resolution than if they're just handed with a bottle and handed with a box and left to go on their merry way. So another situation here, this may be not necessarily where the waiting room is full, but where the wards are full. You've got dogs and cats bulging at the seams in the kennels, and we've got animals that perhaps need seam scrapings, or perhaps we've got an animal that's got an ear problem. And again, nurses can help if you've got a dog with an ear problem. Here's another case. This is Fred. Fred's an 8-year-old Cocker Spaniel. He's got a 2-year history of ear disease, and he's presented to the vet with a foul-smelling, greeny, mucopurulent discharge in his ears. The vet checks Fred and decides, based on the dreadful mess that's there in his ear, that realistically he can't just prescribe therapy. He admits him for cytology to be taken and for some more general assessment to be done from the ear. And again, there's no reason under delegation why you as a nurse can't actually do that. So this is what the ear looks like. It's pretty revolting. We start off with some basic scrapes and some plucks to look for parasites. We're thinking particularly of things like Demodex, things like Otodectes. There's no sign of those in the ear. We take some cytology from the ear pinna, we take some cytology from the canal, and what we get is what you can see at the bottom right-hand corner here. We've actually got large numbers of neutrophils, they're highly degenerate neutrophils, and we've got large numbers of rods. So the minute we see rods there, we take a culture from the ear canal as well. The findings are reported back to the vet, and the vet decides that we need to do a little bit more. So the animals are anaesthetized under veterinary direction, and then you as a nurse are left to examine it in more detail, have a look at the ear canal, assess the ear canal, report those findings. And also, I would be very happy to leave a good nurse, a qualified nurse, a competent nurse to flush the ear out and then apply medication to the ear. There's no reason why a nurse can't do this. After that's all been done, the vet then advises the owner that the cytology has been taken, that the ear's been flushed. The dog has got a very severe infection, but because we have got infection, we want to start the animal on some treatment. So we've taken some culture, and we'll, of course, we'll report back when we've got, but we want to send the dog home on some medication to try and make it more comfortable. So again, then the vet will make up the medication. And again, I've just picked some random drugs here out of the air, just again to talk about general principles. So they've supplied some Otidine as a cleaner, some Ezotic as an eardrop, and some Pardel for some pain relief, because pain relief is really important in all of these cases. And again, this is where the nurse's communication skills come in to explain to the owner how to clean that ear out, how to, flood the ear with the ear cleaner, gently massage it, wipe out the excess. The importance of instilling the ear drops into the ear, and the importance that the ear is clean before those drops go in. The importance to continue with the course and not to stop when they think it starts to look better. And the importance of a recheck appointment, because with all ear disease, we need to make sure the problem's completely resolved before we stop treatment. So again, the nurse's communication skills are actually ensuring that the treatment is being given appropriately, the treatment is being given in the right way, used in the right way, and that the owner is aware of the need for follow-up for that case. So let's talk now about the standalone vet nurse clinic, where the nurse is working independently once you're confident that you're able to actually do this. Now, of course, there are always going to be barriers to running a nurse dermatology clinic, as well as there being enormous benefits. And what I wanted to do was just talk a little bit about barriers, because these are things that, of course, are going to face many, many practices. The first, I think we've dealt with already, and that's the fact there's a lack of knowledge around delegation to nurses. So directed you to that superb poster, which is on the Royal College site. Have a look at that, and it will allow you to impart that information to your vets, and hopefully reassure your vet, your practice owner, that nurses are more than capable of doing this. There are situations where nurses aren't being motivated to run clinics. There are some nurses who would much rather be in surgery than actually be running clinics. And so it's horses for courses. If you're one of those nurses who wants to run a clinic and you're motivated to run a clinic, then really push for it. But if you're a nurse who'd much rather be there sorting out pain relief, post-surgery, monitoring anaesthetics, then do what you're most comfortable with and what really floats your boat. Big problems, of course, is lack of consulting rooms in many of these cases, and COVID has produced huge challenges around consulting room space and our inability to actually even bring clients into the building in many situations. But hopefully, as we start to get some degree of normality back and we start to go back into our normal consulting routines again, we can start to do this. But there's perhaps an opportunity as a nurse to consider changing your hours. You know, it may be that you are prepared to run clinics in the lunch hour and perhaps finish a little bit earlier. You may be happy to do them in the middle of the afternoon when that's a quiet time and those consulting rooms aren't being used. It may be you even want to do something on a Saturday morning, which frees you up perhaps on a Wednesday morning to go and ride your horse or take your dog for a long walk. Staffing issues, of course, is a huge problem, and we know that we have a workforce shortage, but using nurses to run clinics, I would suggest to you, is a really good way to optimize nurse time and to actually enhance the care that we're giving to our clients, and isn't necessarily going to be that labor intensive. So let's talk about the benefits. Let's look, put a positive spin on this, and I've listed for you here. We have benefits to the practice, to the pet, to the owner, and of course to you as a nurse, whether you're a registered veterinary nurse or whether you're a student veterinary nurse. To the practice, it increases staff motivation. Of course, it improves client care. We talked before about that heaving waiting room and clients sitting there getting impatient and dogs getting agitated. It helps actually enhance the care that we give. It bonds clients to the practice. We know for clients that it's quality time spent with the professionals within the practice that makes a difference. It doesn't have to be the vet. It can be that professional nurse that is doing it. And of course, we said before, if we are charging for nurses' time, it has the ability to increase turnover. It frees the vets up to do work that can only be done by a vet that's often got greater fee generating potential, although I've put there, it's not always more important. But of course, nurses are capable of generating income as well. So there is a positive benefit to the practice. Of course, there's a benefit for the pet, improved quality of life. We've already talked about owner compliance, talking about the communication skills of a nurse to make sure drugs are used in the right way. It gives the client that continuity of care. So there's a focal point. The owner has spoken to the nurse, the owner has met the nurse, and they've got that point of contact. If they've got a problem or concern, someone they can go back to. And often it's easier for a client to speak to a nurse than it is to speak to a vet, because they often don't have those big time commitments of a 2-hour piece of surgery or a long morning clinic. And of course, the other thing that's really important, it allows us to enhance our ability to monitor problems, control problems, and also, particularly for skin disease, prevent relapse, because checkups can prevent relapse occurring. Benefits to the owner, improved quality of life for the owner. Many owners get really, really worried when their pets get problems. They get really worried. They have sleepless nights. They struggle to administer medication. So having someone there to help them with that is going to be really useful. So that familiar face to help support them with advice, with education, explaining stuff to them in simple terms. Often, again, nurses are much more approachable than a vet, and a nurse will phone, an owner will phone up a nurse to say, I really can't get the eardrops into the ear, whereas they may feel that they're not able to do that when they're talking to a veterinary surgeon. Of course, as far as the vet nurse is concerned, this gives you a huge amount of job satisfaction. I know that nurses are passionate about animal welfare, and of course it harnesses those skills of nurses who, I've already said, many are great communicators, and we said improves client care, quality of life, continuity of care. For a nurse, there are lots and lots of really strong positives about running a clinic. So what do clients want from a nurse clinic? What do clients actually want when they actually go to a nurse clinic, and when they go to it, whether it's a dermatology clinic or whether it's a weight control clinic? Clients need to feel the service is valuable. So when they come out of that consult, they need to feel as if that's been a useful way that they've spent their time, a useful benefit to both them and their pet. And if they feel it's valuable, then they will be more than happy to be charged, and they'll be more than happy to pay for that consultation. What are little things that we can do to enhance that value? Well, giving them things to take home. And I've just shown for you here on the right hand side just a selection of some of the stuff that's out there, some of the literature that's out there. And then that ranges from drug company handouts through to charity handouts. There are loads of resources there on some of the big charity sites. And then, of course, things like BSAVA have these free downloadable resource drug sheets and things that are there for you. So sending them home with something in their hand is going to be really useful. useful. But the other thing that's also really important, and again, nurses do this really well, is make sure that care is personalised. Make sure if you do send them something home, you do send them home with an instruction sheet. It's got the client's name, and most importantly, it's got the pet's name on it. So they actually really feel as if that's been designed specifically for them. Ongoing care is also really important as well. It irritates me to death when I hear vets having conversations with clients saying, well, see how he goes. Let me know if he doesn't get better. We sometimes expect an awful lot from our clients, and what's really important is we get clients back, we get pets back, we keep an eye on them, we need to monitor them, whether it's skin disease, whether it's ear disease, whether it's diabetes or even weight loss. We need to make sure that we're available, they can contact us if we've got concerns, and we need to be sure that they know what the red flags are. What should start to flag concerns for them with their dog? What signs should they start to worry about to give them an indication that their dog's ear problem's coming back, and when should they contact us to actually make sure that it doesn't come back? So ongoing management is really important. So let's look in the very last part of this presentation at some specifics. Let's drill down about what sort of consultations we could actually do in a nurse dermatology clinic. I've listed them for you here on this slide. Allergy management, really important. Paritic skin disease probably makes up the bulk of the dermatology cases that vets in primary care practice see, and many of those animals have allergy. And it's really important, again, to maintain compliance by actually managing them appropriately. And then, of course, follow-up treatment on all those other problems we've talked about. We talked about the ear problem earlier on. That dog with scabies, to make sure it really does settle down. Dogs with endocrine disease need monitoring, and dogs with more severe and much more uncommon things like autoimmune skin disease. So when we're looking at allergy management, of course, the treatment is under the veterinary supervision, but there's no reason why nurses can't just help monitor that. So a phone call, getting them in for a recheck, make sure that they're happy with the medication that they're giving. If they're taking steroids, we might want to do a recheck. We may want to check a urine sample to make sure we've not got low-grade pruritus. We need to make sure that they're able to give the medication. It may be if there's an injection that needs to be given, I would be very happy to delegate the injection of Lokivetmap to an animal that's stable, to a vet. And similarly, if it's on allergen-specific immunotherapy, it's an opportunity for the nurse to take a history from the client, make sure the dog's making progress or the cat's making progress before the injection is administered. An opportunity to top up on medication. So do they need some more shampoo? Do they need some more medication? You know, if the vet has delegated you to be able to supply those, then I have no problems with you doing that as well. So discussion around how you're going with a low allergy diet. Is he eating it? What tidbits can we give? What supplements might be useful? So lots and lots of things that we can do with allergy management. And remember, when we've got a dog or a cat with atopic dermatitis, it's a disease they have for life. So this isn't something that's done on a one-off basis. I would want my nurses to get the dogs back in perhaps every 3 or 4 months for those rechecks, particularly as we see seasonal changes, just to make sure those animals are remaining stable. Ear follow-up and routine checkup, again, really important. Again, we're not asking nurses to make a diagnosis, but we're asking them to reassess that dog. Have a look in the ear, make sure the ear is clear. Have a look at some cytology and see what there is on cytology. If you've got an inflammatory infiltrate, if you've got bacteria on cytology, you probably need to go and report that back to your vet, and it may well be that dog needs to come in for a full consultation with the vet. And of course, if we've got dogs with ear disease with underlying allergies, they often show seasonal flares of their ear disease. So it may be, if this dog is particularly bad in the summer with its ears, you get them back in May or June at the start of that season for a general assessment, just to, if you're head it off at the pass, to check that dog before the problem actually occurs. Ectoparasite control, we talked about that dog with sarcoptic mange. It might be a dog equally with demodectic mange. We meant to make sure the pruritus is settling down. We want to make sure the dog is comfortable. For demodectic mange, we need to repeat skin scrapings, because when we're monitoring demodectic mange, we're looking for the presence of mites. It's difficult to find mites on sarcoptic mange dogs once they've had treatment. We're really monitoring those on clinical signs and improvement. But with demodectic mange, we're looking at microscopic monitoring. How many mites are there? Are they alive? How many immature forms are there? How many eggs are there? It gives us a feel to how well the animal is responding to medication, and then allows the vet to adjust the treatment based on those investigations that you've undertaken as a nurse. So ectoparasite monitoring, another great way to improve owner compliance, to improve client and pet care when it comes to parasite control. Endocrine monitoring, certainly for me, dogs with hypothyroidism, cats with hypothyroidism, I want them assessed. They can't tell me that they're feeling a bit lethargic if they're a dog, or if they're a cat, they're feeling a little bit tachycardic. We want to check them, we want to get them in, we want follow-ups, we want to make sure their clinical signs are responding. The hair is growing back. We may want to do some follow-up blood. So again, I'm very happy with nurses doing that, rather than the vet handing out medication and saying, see how he goes, let me know if his hair doesn't grow back. Similarly, at the bottom here, this is a dog with very marked calcinosis cutis, calcification of the skin. This dog has got hypoadrenocorticism. This is going to be a really slow process to resolve this dog's clinical signs. So again, it's useful for nurses to assess them, just to chat through with the client how they're coping with the bathing, how they're coping with the feeding, how are we going on with his weight loss as we start to bring his disease under control. And again, they can do follow-up bloods to ensure the animal is actually being monitored appropriately. So little things that make a huge difference to clients and their pets when it comes to monitoring disease. And then finally, not something that you'll see very often in a primary care setting, but animals who have very severe autoimmune skin disease. These animals can become very unstable, certainly if they're on some of the more potent drugs, things, for example, like azathioprine, things like chlorambucil, for example, if it's a cat. These animals need to be monitored, they need to be assessed. And again, if we've got them on drugs like steroids, there is the potential for side effects. So again, those conversations with clients about weight increase, about feeding, about fluid intake are things that the nurse is more than capable of doing. So here's my last slide, our summary slide. I mean, hopefully, I don't think I need to tell you nurses out there, but nurses are valuable members of the vet-led team. There is no reason why nurses cannot do their own clinics, but I would suggest, as a stepping stone to running your own clinics, I think it's really useful to start to work closely with your vet to build your own confidence and to build the vet's trust in your skills before you take that next step. Once you feel able to, once you feel confident enough, then there's no reason why you can't go for it, because nurses can run dermatology clinics, they can enhance client care, they can make a valuable contribution to the practice, animal care, and of course financials as well. And as far as I'm concerned, every single practice should have a veterinary nurse dermatology clinic. So thank you for your attention. Hopefully that's been useful, and do enjoy the rest of the Vets for Pets virtual congress.